Supine, hip abducted, Gracilis, and adductor stretch. In this stretch modality, you're going to have the client lay supine. So they're going to be supine on the table or on the plinth. You're going to elevate the involved side leg until you feel a resistance, or what we call end range feel, right? End feel. So as you start to get into the early stage of end feel, but not a big stretch, from that point, in this stretch, we're going to be focused in the adductors. There are some other stretch therapy modalities that are very similar to this one, but this one, others are more focused in the flexion position. This is going to be focused heavily into the adductor position. So you have the client bring the hand to the abdomen, because you'll need to sit somewhat close to them to start. You'll want to take your contralateral hand to the involved side. So this side, press down within reason, but firmly on the pelvis, and then bring that leg out and ask the client on a 1 to 10 scale, how much stretch do you feel?
5.5.
Good. So we can go 5.5 to 6. Caitlin's a very athletic girl, so we could go up towards 6. Her tissues are used to being stretched and trained and all these type of things. So she's going to have a little better health result from having a little higher intensity, whereas someone who's not used to that, you wouldn't want to go to a 6 in this. 5.5 would be plenty. So once you're there holding that position, other things you can do is use your body to stabilize the leg. You can use a massage gun to start more towards the origin of the gracilis and work through the tissue. And with your hand, you know, this is one of those areas that you, depending on the clients, your comfortability with them, in making sure that they're okay with that, you can go closer to the groin, but not on the groin, of course, with the massage gun. But manually, I would start 4-5 inches away from the groin, where you can work through the gracilis there. And again, that's just all depending on your professional relationship with the client and their comfortability. Potentially, if it's a longer term client, you become more used to your body work that you do on them. So, of course, always number one, keep the client comfortable. But you can just knead through with the thumb, working through that gracilis, and Caitlin's really feeling that a lot here. So yeah, you can either just apply the stretch, or this stretch is usually done on someone who has a lot of knee valgus or internal rotation, so that gracilis can be nice and tight, or not nice and tight. So you can just work through that area with massage.